Hello, I'm Dr. Tony Das. I'm an interventional cardiologist. I'm the founder of Connected Cardiovascular Care Associates. We're a cardiology group that deals with patients that have cardiac and vascular conditions. We perform invasive and non-invasive testing on patients to assess their cardiovascular health. So patients often ask, what is a heart catheterization or a vascular catheterization like? Here's a few things to get you to understand what the procedure may entail for you if you're offered one of these for evaluation. The first question is, what's the reason I might need a heart catheterization? And the answer is, your doctor is evaluating exactly how much blockage and where the blockage is in your heart. They may also do the same thing if they're concerned about blockage and vascular conditions in your legs or other arteries or veins in your body. The way the procedure is done is often asked, and the procedure is done invasively with a small catheter. It's about the size of a piece of spaghetti, and we go in through an artery or a vein, either in the leg near the groin or in the wrist. In each of these procedures, we're able to get to the heart with a combination of catheters and wires to be able to see where blockages exist. The first step is to schedule the procedure. After your physician has decided that you actually need an invasive procedure to assess the blockages in your heart or in your vascular system, you'll be getting a call from our scheduler. That scheduler will allow you to choose the day that's best suited for you at the time that the physician can also do the procedure. We frequently do these procedures early in the morning, starting as early as 7 a.m., and the patients will often have to be there 2 hours before the procedure. You will also need to be fasting before you come to the procedure for at least 8 hours before the procedure is performed. So what happens on the morning of the procedure? You'll arrive at the hospital or the outpatient cath lab, depending on where we do the procedure, about 2 hours before the procedure. Once you arrive, you'll be there and you will be accompanied by a nurse and the team, which will assess you for any issues that you might have had in the time between your office procedure and the actual invasive procedure. Say, for instance, if you've had more symptoms, chest pain, shortness of breath, or any change in your overall condition. The next will be, after a short physical examination by the nurse, you'll have an IV placed in your arm. That IV will allow us to deliver medications to be able to keep you comfortable. This is a relatively easy procedure for most patients, and oftentimes we hear, I was very nervous about it, but after having the procedure done, it didn't seem nearly as complicated to them as they thought it might be. As mentioned previously, after the nurse puts in the IV and after you get to the heart catheterization lab, you'll be on the table where we actually do the procedure. There'll be an x-ray tube that comes over the top of you, and there'll be lots of equipment in the room. And then the first thing we will do is prep the location which we're going to go in. As mentioned, we can go in through the wrist, which is actually very easy on the patients, or go in through the groin. We choose one or the other based on where we want to actually evaluate the arteries. If you've had bypass surgery or other conditions, or we're going to fix your legs or carotid arteries, we'll go through the legs frequently. If we're going to fix your heart, about 75 or 80% of the time we go in through the arm. Once you're on the table, what happens is that we give you some medication for local anesthesia and what I like to call I don't care medicine, which is essentially a twilight medication that makes you sleep and forget the procedure. And oftentimes you're very comfortable during the procedure. Once the procedure is being done, you may kind of fade in and out of the procedure with this twilight anesthesia as the doctors are working on your heart. You don't feel too much pain or discomfort because as the catheters go in, you really won't feel them. We inject contrast dye through the catheters, which allows us to see the arteries and the veins in your body. We also measure pressures in your heart and we can assess whether or not there's any significant blockage that may or may not need to be fixed. We'll make that assessment at the time of the procedure, and we will proceed frequently doing the diagnostic pictures and the fixing of the arteries with stents, balloons, and other catheters that we have at our disposal at the same time to try to avoid more than one procedure. After the procedure, you will frequently be at bed rest for a few hours, 2 to 4 hours, to make sure there's no bleeding complications, there's no issues with the medication, and that you're safe to go home. 95 to 98% of our patients will go home on the same day. There are some procedures which we will keep you overnight. Those procedures include the valve procedures that we do for TAVR, patients that have carotid stenting, and patients that have aneurysm repair. But for most of the heart procedures, you can assure that we will likely send you home the same day. What's the recovery like, many people ask? Well, the recovery is essentially 2 days of no heavy lifting, no driving, just to make sure that none of the sites that we went in have any pain, discomfort, or bleeding. And then after that, we just increase your activity and we allow you to do pretty much anything you want to do within 5 days of the procedure. Frequently after the procedure, you're a little groggy. So we explain what we did and show pictures and diagrams to your family members, and then we describe all of that when you come for your first office visit. We frequently will ask patients to come in for an office visit within 2 weeks of their procedure so we can go over what we did and what we need to continue to do to keep their health best. If you have any other further questions, always feel free to contact the medical assistant or our office staff, and we'll be happy to answer any further questions.